My name is Ellie and I'm a sports and remedial massage therapist at North Adelaide, myPhysio. Today we're going to be talking about pre and post massage stuff, so going into some techniques for your pre-event massage and then going into some techniques for your post-event, and then I'll go through a couple of techniques for sort of more of your deeper stuff, training nights, or yeah, you don't want to sort of go too deep until you get to those training nights. So basically what we're going to start off with is the quads. I'll do some light tissue massage pre-event, then I'll do some post-event stuff, and then I'll sort of move more into maybe your training night sort of stuff, your trigger point stuff. So quad group, you're working on your rectus femoris, vastus lateralis, vastus medialis and vastus intermedialis, and they all come down and join into the patellar tendon. So starting off at the ASIS, coming down all the way through. So your main techniques that you're going to start with your softer tissue, you're working to try and excite the muscles, increase the circulation, and you're also trying to just sort of maybe excite the muscles but calm the player before they go into a game of sport, because they can be a bit on edge as well. So your movement's going to be quite quick when you're first starting. So you start with some effleurage. So coming down, I'm just using an oil. Most clubs will supply a Premax solution or a sorboline, doesn't matter what you use. All's quite good. I use the oil for the pre-event just because I just find it glides a bit better rather than trying to get too deep with the sorboline. It sort of sticks a bit more. So effleurage is just basically up and down, moving around, heavier on the way up, lighter on the way down. And you're going to do sort of each limb for a couple of minutes. You're not going to be too long pre-event. You don't want to work more than 15 to 20 minutes if you have that time. Most people don't in the sports club. You got, 10 minutes per person, yeah, and you only get through about 10 of them in that time anyway. Yeah, that's it. All right. Next, we're going to move into some petrissage. I can feel that that's starting to feel a bit warm now, and that's when you start to move on. So petrissage is just moving, picking up that muscle, and you can start to move quite quickly. So you're picking up the muscle and rolling over the top of it all the way up. Now, it's not deep tissue massage, but I'm not going extremely light either. So we are moving the whole muscle. The aim is to get that blood pumping through, get the muscle excited. So it's not really light either. Then what I like to do after the petrissage is come in and work laterally to medially, coming across over the top of the ITB, over the top of the rectus femoris. And then you can come the other way around as well. So coming in medially. You can come into some fist movements, nice and quick, up the side of the ITB. And all the way up, so coming in through the top at the ASIS there, at the tendon of the rectus femoris, moving it across the hip flexors as well. And that's probably all you're really going to have time for because you're going to do you're not just going to do one quad for them, you're going to do both quads, you're going to turn them over, you're going to do hamstrings, you're going to do calves, so you're not going to have too much time, and that's quite warm. You're feeling quite good through there? Yeah. So now what we're going to go through is your post event, which is a bit deeper, a little bit slower, and you can start to get stuck into some of those spots you're quite tied up through there. So pre-event, you're looking at getting the circulation going through, and you want to reduce a little bit of that tension as well. They're going to be quite tight. You want to get some lymphatic drainage through. They've probably, you know, just had a heap of cramps. They've played a long game. So it's a broad movement right through. You can come in with the forearm as well. Make sure you're not using the bone. You're sort of coming in nice and wide, all the way up, rolling over the top. All the way through. Then you can start to go through a bit of stripping. So starting at the patella, applying a bit of pressure. I'm starting to push my body down into it. I'm using my body, I'm not using my arms. Sorry, I should be not using my arms. And this is a bit of a myofascial release and a bit of stripping through the top there. It'll be quite tight. All the way up. And work right through all three muscle groups in the front there as well. Don't just stick to the side. You'll find a couple of, for training nights, I would do more trigger point therapy, deep tissue massage. Pre-event, I'd probably just do more of the deeper gliding techniques. So when you start to go to your training nights, you'll find there's a couple of trigger points coming up into the hip flexor tendon. So up the very top, mid-belly. Sorry, I'll move that up. So up the very top, find that ASIS, just drop below, you'll find it's quite tight through there. And if that muscle's quite tight, you can work like this as well. If you want to get that muscle nice and soft, just pop your knee under, pop a towel under or a bolster under. It just helps quite a bit. And just hold those spots down. How's that feeling there? Good. You'll find there's also a couple up through the front on the side there, right near the ITB where it crosses over. Just bend your knee there for me. Pop that knee over the top and then drop that knee down onto your thigh there. And then you can work through, same sort of thing, pre-post, stripping down. You'll find it gets quite tight through there. I like to do things in a bit of an order. So you don't want the person, you've got limited time, you don't want to be putting them over, flipping them over the other side, then getting them to turn over again like they just don't have enough time to do all that. So if you're there, just work on it. So you can go through the adductors that way. And then what we can do is we can also go, just leave that foot there for me, you can also go into a bit of a stretch, so holding on to the opposite hip, coming down, just giving them a bit of a stretch through that adductor as well. So just starting off with your effleurage. Your quadraceps, so coming in, working through the back of the leg all the way up. So here you've got your biceps femoris on the lateral side, coming all the way down. Actually joins into the head of the fibula, so make sure you're working all the way down past that knee as well. Just do some rocking motions as well, it's quite nice, wakes up the muscles a little bit. And then on your inside you've got your semitendinosus and semimembranosus, and they come down in past the knee to the front of the tibia area, so you can work through those areas as well. Now, what I like to do post-massage is just pick up that ankle and use that as a lever. So what that does is it shortens, lengthens the hamstring. And what you can do is you can actually use this to your advantage. Make sure you not have to work as hard. Pop that arm down. As you just relax that leg and let me move that. That's it. As you lower it down, work on up through the hamstring muscles. And then come back up again, start again from the bottom. And up. And up. So you'll get a bit of a myofascial release with that as well. You don't have to use a lot of cream. That actually works quite well if you have minimal cream on and you're just working through, letting that arm glide up through the skin. It'll just nice and softly go right through. You'll have a few trigger points in the hamstrings up underneath near the ischial tuberosity where it actually connects on. So you can start to work a lot deeper through here. You get a lot of guys football players will have a lot of scar tissue in through here anyway, because you've got your hamstring tears that happen quite high up or mid-belly. Yeah, so they get quite tight and stiff. So you just want to work through nice and deep. Is that pressure okay there? Yep. Nice and deep underneath through those areas as well. It's a bit of friction work. So friction's your deep. You can do cross friction fibres, so across the belly of the muscle, or you can do against or circular. Okay. Any questions about the hamstrings at all? No, all good? Okay. Glutes, you don't warm them up. I never used to warm them up too much. You won't really get someone unless they're really tight that come to you and say, look, I need a glute release. You can warm them up just by going over the top. I just use sort of a knuckle action and just roll over the top, and this will wake them up quite a lot. Pre-game, and you can also do some folding, so coming in with the arm up and over, so rolling over the glute med, glute min, glute max all the way down from the greater trochanter, coming all the way up. And I wouldn't do more than that before. Coming into pre-event is when you sort of want to do more of your release off stuff, your deeper tissue stuff, player that wants their back released. So coming through, you've got your posterior iliac spine, just roll on through the bottom, just underneath that, and that will get all the top of the glutes as well. So you can do deep tissue work through there, coming down. And there will be a few tight spots in through there. How's that feeling there? Quite tight? So just hold. If you find a spot, you'll feel them flinch a little bit too. Just make sure you're sort of paying attention to their body, because you will feel them move as you find a more tender spot. And they're the spots that you want to work on a bit more post-game, training game, even if, yeah, they're the spots that they want you to work on. So coming in under and just rolling back and forth across.
The other really important thing that I think is worth noting is... And
then you can move up into the lower back as well through here. So some players might want a bit of a... You're right. Cool. So you've got your ribs, bottom of the ribs, and then you've got your top of your PSIS through here, and that's in between there is where the QL sits. So you want, for deeper tissue stuff, just to roll in under and over the top. So come in under and roll in through over the top. Okay, and that will release that QL quite well. They will be quite tense. You might get a little bit of the muscle reflex in through there that just kicks back, because it will be quite tight. Just sort of get them to breathe in and out and just hold on to that spot. Is that right there?
You're just using your thumb.
Yeah. So I'm just got, with this one thumb in, and I sort of place that other thumb underneath, and I just come in. Yeah, and I'm not really using my thumbs as much. See how my body's nice and straight? I'm coming in and I'm rocking my body in through. So that saves my fingers a little bit as well. Especially if you're doing, 10, 15, 20 players, you're quite sore afterwards. You've got to start to use... I do for the glutes, which we're coming to now. So after I've done that, come back down post-event. You want to sort of loosen off their glutes. They get quite tight through their glutes quite a bit. What I do is I use the leg as a lever, so internal external rotation actually moves the glutes, and then what we do is we'll find a couple of trigger points mid-belly in through here. You've also got your piriformis in there, your sciatic nerve as well, so you'll have quite a few tender spots that you'll be able to find, and you'll know when you're on them. Elbow in, and just when you find that spot, internally, externally rotate a couple of times, and that will really release it off. It's a really good technique to get their glutes nice and loose. How's that feeling there, all right? Yeah, make sure you talk to them as well, because it can be quite full on. Yeah, see, you're not working as much. It's sort of working in your favour. Yeah. And it's really he's really easy lever to move. Like, I need 2 fingers to move his leg. Coming up to the top, glute med, glute min, same thing. Roll it in, roll it out. And then down further you get into more of your piriformis glute max. Yeah. And again, rolling through. So I probably wouldn't do too much of this post-match. It's quite heavy. I would save it for, pre-match. It's quite heavy. Post-training sessions, it's quite good. Just for a bit of support, if you've got a bolster, you can use that. But I find it quite easy just to chuck a leg under there. So start off with it just sort of loosens that muscle off too. Like, it's not tight anymore, whereas this, like, there's just limited movement there. So coming down, starting off with your effleurage. You can actually move into some flicking as well. This applies to the hamstrings, quads for pre-event. Moving up and just flicking the fingers over the top, and that will just warm it up nice and quickly. It gets the muscle and the nerve endings excited, so it gets them ready to go out and play, ready to run, ready to switch on those muscles. And you can come across and do your petrissage. It's easier to do petrissage through the calves just because it's a smaller muscle group. And then what you're going to do is pick up that calf, pop down on the shoulder, clasp the hands together and just work over the top. Work through the medial and lateral calves. You get your soleus coming in through the sides. You won't get that through the middle, so you want to work in through the sides as well. And you'll get your tib post and perineals on the lateral side as well.
Do you do anything like to separate the gastroc heads?
Yeah. So I will basically, with your effleurage petrissage, you start to move medially, go right up from the tendon and coming up. You can also do it through this way. You can have that foot up, separating those heads. Yeah, so with massage, you want to increase the circulation. So blood pumps body out, you want to pump that blood back up to the heart. So I always start lower, work up through the body. You can start at the ankles or calves. I sort of tend to just start wherever they need it. But it's always lower limb to the upper limb. Alright, so then we can do some milking as well. So coming down, linking those fingers together and just working straight down. And from this position, it's quite easy to give them a bit of a stretch as well. So coming in around, using that ankle, grabbing the heel, pulling down. This will stretch the soleus out because you've got the knee bent. Soleus doesn't pass the knee. And then just releasing off. And you can go down a couple of times. And then for the gastrocs, I'll just get you to squiggle down a little bit. What I like to do is use my leg for this one. And you might have to come down a little bit further, sorry mate. And just push that foot in there. You can even, post-massage, you can even massage like this. So you can, like the same with the hamstring where you've got it up, start here and start to move that leg in as you strip up through the middle. So coming through. So you're sort of moving that gastrocs, tightening it off, getting a really good tissue release through that way. Now your trigger points for your gastrocs soleus, you generally have them up near the insertion. So you'll find a lot of tender spots up through the top. And soleus, you're stripping through the sides, mid-belly through there. Then you also have up through medial, you've got your tib post tucked in behind the tibia. You can get stuck into that as well, that will get quite tender, so you can use your thumb down that line there. Alright.